Now we know how to prevent the spread of infection, but what exactly causes an infection? In order to develop an infection, pathogens need to get inside your body. By pathogens, we mean virus, bacteria, or microorganisms that cause the infection. These pathogens can enter through exposure to other infectious materials via open cuts, skin abrasions, and mucous membranes of the mouth, eye, and nose. Pathogens can enter your body and infect you through two ways: direct contact and indirect contact. Direct contact means that the disease-causing bacteria or pathogen is passed from one person to another when their bodies touch in some way. This could happen through open cuts, nicks, or skin abrasions, touching mucous membranes of the mouth, eyes, or nose, even accidental injury by a contaminated sharp object. A contaminated sharp object would include anything sharp that could puncture your skin, including needles, razors, broken glass, even exposed dental wires. Indirect contact of pathogens can occur by touching something contaminated and then touching a mucous membrane or open skin. This could occur through droplets in the air, such as with tuberculosis, or through touching a surface that an infected bodily fluid touched. For example, hepatitis B can survive on environmental surfaces such as counters or floors, dried at room temperature for at least a week. This means that if you have a cut on your hand and touch a counter where the hepatitis B virus is, you could contract the disease. Let's go through some examples of direct and indirect contact, as well as the precautions we should take. In the first example, our patient has had a terrible cough and was just diagnosed with pertussis. He is now on droplet precautions. How should we prepare for treatment with this patient? Let's see what this therapist does. This patient is on droplet precautions. What did the therapist do to prevent? Yes, our keyword prevent. What did the therapist do to prevent the spread of infection? What PPE did she utilize? She used a mask, right? That is how she prevented the spread of infection. Now, is there anything she should have done differently? Picture what you just observed. She didn't put on gloves, did she? Remember that droplet precautions, the use of a mask, are in addition to standard precautions. Let's try another scenario. We have a patient who has diagnosis of C. diff diarrhea who needs to go to the bathroom. What type of precautions are recommended for this patient? Again, let's see what the therapist does. Now that you saw this video, what types of precautions are being recommended for this patient? Your choices are standard, contact, droplet, or airborne. Right, contact precautions. In the two videos you just saw, what was one key thing this therapist performed before she entered the patient's room? Yes, she put on PPE. Personal protective equipment should be before we enter a patient's room.